Hi, my name is Valerie Worthington, and this is the latest in a series of conversations I'm getting to have with friends and colleagues of mine who train Jiu-Jitsu. This is part of a larger effort called Grappling with Answers. And if you like what you hear here, please feel free to find us on YouTube and subscribe there and tell your friends, and also find us on Facebook. And today I am getting to talk again with my friend Eric Marandino, who is a black belt and who is also an EMT. Eric, thanks so much for joining me again. The first thing I wanted to ask you was to talk about your day-to-day in the past week or so, and say a little bit about how that might be different from the way things were the last time we talked.
Okay, first, thanks for having me back, Val. It's good to see you again. Yeah, things have definitely gotten different from the last time we talked. It pretty much, the whole quarantine thing and the whole hysteria had pretty much just started when we had talked last time. So now that we're kind of in the thick of it, and again, this is just what I see from day to day. I'm not making any medical claims or anything. I'm not a doctor or anything like that. We talk about like the call volume and the type of stuff that we see. My day-to-day stuff, like our 911 calls, pretty much have stayed, like the call volume has stayed about the same. I personally haven't seen a lot of people for like difficulty breathing situations specific to, having COVID. A lot of aches and pains, running a temperature, that type of stuff, and the patient turns out to be positive for it. They're very good about getting back to us and letting us know, you were in contact with such and such a patient, and they did, test positive for it. Where we're really seeing it, and this was probably 3 weeks ago, our volume it doubled almost overnight. And what it is like our routine transfers, where we take patients for dialysis back and forth who need to be taken by stretcher, who are in nursing homes. Now people who otherwise were healthy that could go in a wheelchair van, they have to go under isolation precautions now. So they have to go by ambulance. So almost overnight, our volume as far as our routine stuff doubled as far as that. As far as like the patients that we see, I don't know the exact numbers, but going by what I see, probably 75 to 90% of them are all positive at this point. Nursing homes are basically overrun with patients that are positive for it. That's just the nature of it. They go in there and they got to go somewhere under isolation precautions, so they're going to nursing homes. As far as the hospitals go, from what I've seen, they're not overwhelmed like a lot of people see on social media or on TV or anything, like what's happening in New York and stuff. I can't speak for other hospitals, just by the main ones that we are at day to day. They're not really overwhelmed. They're working very, very hard just because of everything that's added to this, because of taking precautions and stuff like that. And yes, there are other serious cases where people are on vents and it's very life threatening. But the majority of stuff that I've seen is patients that are positive for it. It's how do we take care of them? Where do we place them so that they're under isolation precautions to try to stop the spread of this? So that's, in a nutshell, that's kind of where we're at from what I see day to day.
And for context, you're in Hartford, Connecticut, correct? That's where
Yes.
That's where you're an EMT.
Yep.
And so it sounds, Eric, like you're being exposed to people who've tested positive for the virus basically all day, every day. Is that fair to say?
Pretty much, yeah.
So you are, I'm assuming you're in PPE for your entire shift?
Yeah, it can be miserable wearing a mask all day. I really sympathize with nurses, doctors, and stuff that work in the hospital. That's just what their normal has always been. This is the new normal for us. Initially when this first started, and I remember talking with my partner, we were just kind of like on edge, waiting for that first call. The first 911. Difficulty breathing, take precautions. And now that's pretty much every call. So that is the new normal for us. So we're used to taking the precautions. The reality is, yes, we are in contact with people and patients that are positive for this, but we're taking all the precautions. So, for better or for worse, hopefully we don't get sick. We do have coworkers already that have tested positive for it. Some have had mild symptoms. Some have had bad symptoms where, 2 weeks of very bad flu-like symptoms. We have one coworker right now. Unfortunately, he is on a vent, at the hospital. So it's, again, it doesn't look like there's any rhyme or reason for who gets really sick or who, gets through it just like a normal flu. So, all we can do is, take our precautions.
Yeah, well, first of all, my best wishes to your colleague, and it just must be a little bit surreal to see, to be on the front lines that way. One of the things that you had mentioned earlier, you used the word hysteria, and I think that's a good word to use just in terms of people's energy and emotion level. And as someone who's on the front lines, who's seeing patients on a regular basis, you were mentioning offline that you hear people talking about various conspiracy theories, and I was wondering if you wanted to speak to that just a little bit.
Yeah, I mean, again, a lot of it, and I'm going to refer back to one of the interviews you did with, what was his name? Tim. I had it written down here.
Tim Dawson.
Yes. He was talking about stuff as far as the way the media can spin a story in one direction, and it's kind of turned into a political thing, this side or that side. So there's definitely a lot of that. They talk about fake news and stuff, and it's literally just flip the channel and you're going to see the opposite side, the opposite opinion. I think it's good that people question everything that comes out. That's always a good thing to do, but check the resources, check the references, and don't go by an opinion. Everybody can have an opinion. That doesn't necessarily mean that it's right or wrong. I choose to follow the science behind it. And the bottom line is just be a considerate person. You can only take stock in what you do for yourself as far as protecting yourself. I can't determine what everybody else is going to do out there. I can only do what I'm going to do to make sure that I'm safe and that, I'm not going to be a danger to somebody else, let's see. Yeah, so that was pretty much it. Like I said, I didn't want to really go into specific conspiracy theories or whatever. Just people just need to do research, and I think
sort of channel that nervous energy into finding credible sources. And finding out, finding sources that you feel are credible, and as opposed to sort of giving into that hysteria like we were talking about.
Yeah, and I think a lot of it goes to, I can understand, people are losing their livelihoods. I saw a number, I don't know how accurate it is, 100,000 businesses are not going to be able to reopen when this is all said and done, just because of the financial devastation of not being able to go back to work. And that's completely understandable. I understand people want to go back to work. They need to go back to work, but it's got to be done safely, and, the government, for better or for worse, I believe they're trying to do this as safely as possible. And I go back to the CDC recommendations as far as, the way this should be done, in phases, and then certain precautions have to be taken like that. I do jiu-jitsu. I want to get back on the mat just like, all my teammates want to do, but it's got to be done safely. It's got to be done in phases. And to be honest, I don't know exactly how that's going to work or what the time frame is that's going to be. For myself personally, like I said, I can only go by what I do for me to protect myself and to protect my teammates, my friends, everybody that I'm around. I'm literally going to be the last person back on the mat, when this is all said and done. That 14-day period where you come in contact, where you could potentially show symptoms and all that stuff. For my job, I'm in contact with that every day. So every day starts the new 14-day count to, am I going to get sick? And that's the way that I have to think about it. I miss my teammates, more than I can even say, and I want to get back to training. But if I'm back on the mat before the end of the year, I'll I'll be very surprised. And that's just me. I really believe I'm going to be one of the last ones to be back on the mat training.
You raised something really important, Eric, that seems to be kind of a common theme across all of these conversations that I get to have, which is that, behind every opinion, behind every statistic, there's a person, right? There, at least, there are people. And I really appreciate that you brought up that, there are people whose livelihood hangs in the balance. And to me, that it really does come back to, we can only do what we can do, right? We don't have control over other people. We don't have control over the circumstances. We can only control what we can control. And as you said earlier, also, try to be understanding and kind, particularly if someone has an opinion that's different from yours.
Yeah.
So can you say a little bit more? You talked about your day-to-day. Can you say a little bit more about what you and your colleagues are experiencing in terms of, where you are mentally and the kinds of conversations that you're having with each other and the things that you wish people who are not in your situation knew about what you're experiencing?
Yeah, I go back, I use the term the new normal. And I think we all agree that we're never going to get back to the old normal. I think that's over and done with. And I think there's going to be a lot of aspects of day-to-day life in our society that are going to be completely changed. And because of the quarantine and the isolation and everything, I think we're all finding ways around what our new normal is going to be. For my job, like I said, we are literally just thrown into it every day. There's no easing into this thing. It's just you're just thrown in there and you got to do the job, basically. So our day-to-day has become very much the new normal for us. Somebody asked me the other day, how's morale at the company? And you would think, God, we're getting buried with all these COVID positive patients. It's got to be stressful. And it is. But, we're pretty much used to it now. It's the job. We go in there and we do our thing. I have amazing coworkers and we vent. Everybody has a bad day and stuff like that. But for the most part, morale seems to be really good. And like I said, we have to take precautions on every call anyway. It's what we do outside, outside of work when we get out of there. And I can't stress that enough. And I think that's going to be the key to, the country and the world getting back to some type of normalcy is, just be considerate of other people. If you don't want to wear a mask because you think that it doesn't do anything or you think it's a conspiracy theory or anything like that, be considerate of the people that you're around that might not want to be around you if you don't have a mask on, and going back to different businesses reopening, the gyms, that's one thing, of course, that's on our minds. We want our gyms to be back open and stuff, but how do you open back up a restaurant or a bar or a concert or anything where there's going to be any amount of people there? And I think that the bottom line is the more diligent that we are as individuals, the better of an outcome that we're going to have down the road.
Makes perfect sense. And so you talked about a new normal for you professionally. Do you have any sense of what a new normal is going to look like for the world?
I have thoughts on it. I think people who were able to keep their jobs and were able to work at home, I think these big businesses or even small businesses where they send their employees home to work at home are realizing, hey, we don't really need them to come into work. So the whole landscape of these giant office buildings with cubicles all over. I don't know, maybe that'll kind of go by the wayside just because they don't need that. The whole social distancing thing, I've been in very close contact with my close friends on a daily basis. That's how I keep my sanity, is by texting, calling, sending those stupid memes. I'm big on doing that all day. But I think once it's said and done, like me personally, I have no interest in hanging out at the bar. I really don't. I want to go and hang out on a deck, have a beer with a friend, or have a dinner party with some friends. Like I think that's going to be what a lot of people are looking to do, because that's what we're forced to do to find how to keep a connection. That's what we're limited to. And I think that people are just finding, the ways to get around what we're going through.
Absolutely. And there's a a huge spike in the number of people using things like GoToMeeting and Zoom and whatnot, so that so people are staying in touch that way. What have we not talked about this time around that you think it's important for us to cover?
Um, yeah, I mean, these are just random thoughts, that I have. So some of the things, like the whole quarantining thing, there are some things that, like me personally, I don't understand. And again, this kind of goes along the line of conspiracy theories or whatever. But when you have like a big company like the Walmarts and stuff like that are allowed to stay open because they sell food, but they're also allowed to stay open and they're still selling retail stuff like bikes and t-shirts and stuff. But then you get the little mom and pop shop that has to close because a bike shop they're closed, or a retail shop that's closed. Um, like I don't really understand how they came up with their criteria of what's essential, what's not essential. I have any number of friends that own small businesses, hair salons, tattoo parlors, small businesses that are just they're waiting to get the okay to open back up. So stuff like that I kind of think about. Hazard pay, that's another big one that I kind of keep thinking about. And let me be clear, like me and my profession, me and my coworkers, we don't consider ourselves heroes. People are referring to us and the nurses and the doctors. We're not heroes. This is the job that we signed up to do. We go in and we do our job, and we're happy to do it. But hazard pay, that's been thrown around a couple of times. Hopefully something goes through with that. That'd be pretty great for us. But if not, it is what it is. We're just going to keep doing what we're doing.
It's amazing what listening to you talk about, sort of embracing your new normal. It gives me hope, because one of the things that humans do have is resilience. So I think all of us are being tasked with drawing on our own resilience so that we can get through this in whatever way we can. What are some ways, and this could be a good way to end, what are some ways that you are keeping yourself sane? You mentioned staying in contact with your friends and sending out memes and things, and what if anything else are you doing to kind of keep yourself grounded and moving forward?
Definitely exercise. Try to do something every day. Try to break a sweat every day. That would be the big thing. For people who aren't big on exercising or doing anything, now is the perfect time. Get out, go for a walk, do something. Getting outside, that's a huge one. The whole vitamin D, that's the new big one that everybody is seeing on the news and across the board. Low vitamin D supposedly is another thing that can affect how you get affected if you catch this. So getting outside, getting some sun, going for a walk, that's a big one. For me personally, I've been reading a lot. I'm a movie buff. I've been catching up on a lot of movies. And staying in contact with friends. That for me, that's the huge one. I live here by myself, so I reach out. I'm talking to my friends on a daily basis, just to keep in touch, just to bug people more than anything.
It's a good. I think it can become easy to get a little bit of tunnel vision, or to kind of settle into a routine that is a little bit more solitary. But yeah, it probably could be good for a lot of people. I know it is for me to try to stay in touch. So, Eric,
the mental health thing, that's going to be the big thing. Exercise helps with that. And for like me, all of our jiu-jitsu friends, we exercise, and that's what we want to do. We can't do that now, so we got to find other ways to kind of alleviate that stress. But the whole mental part of it, like mental illness and all that stuff, being isolated is probably the worst thing that you can be doing. So reach out there, reach out to a friend, family, anybody, and just try to stay sane.
I think those are words to live by and good words to end on. Eric Marandino, EMT and black belt, thanks so much for talking with me again. I appreciate it. And glad to hear you're taking care of yourself and staying sane.
Right. Great to talk to you again, Val.
Okay.